to the Thyroid Stimulating Podcast, where we delve into the complexities of thyroid health and its impact on our lives. This podcast was created in partnership with the American Thyroid Association to discuss up-to-date diagnosis and management of a wide array of thyroid diseases. In our first episode, we had the opportunity to meet with Dr. Bianco to discuss the benefits of using combination therapy, T4 and T3, for the treatment of hypothyroidism, a condition that affects so many individuals, particularly women. In today's episode, we will be shining a light on thyroid cancer survivorship. Thyroid cancer is the most common endocrine malignancy, and it's estimated that over 43,000 new cases of thyroid cancer will be diagnosed this year in 2023 in the United States. Thankfully, overall, differentiated thyroid cancer has an excellent prognosis, with a 5-year survival rate being over 98%. Most patients are successfully treated, leading to a large and steadily increasing number of thyroid cancer survivors. We have a very special guest joining us today, Dr. Anupam Kotwal. Dr. Kotwal is not only a highly respected physician scientist and an endocrinologist who trained at the Mayo Clinic, but also a thyroid cancer survivor. He joins us from the University of Nebraska Medical Center, where he is currently an assistant professor of endocrinology, and his medical practice focuses on the diagnosis and treatment of patients with thyroid cancer. Dr. Kotwal was recently diagnosed with thyroid cancer. He brings a unique perspective to our conversation, combining his medical expertise in thyroid cancer with firsthand experience of being a cancer survivor. Most of us as physicians hope to never be in the role of being our own patients. But for Dr. Kotwal, this is a reality. Thank you, Dr. Kotwal, for joining me today to talk about your personal journey from being the doctor to being the patient.
Yeah, thank you for that introduction. Pleasure to join here and, give some points about kind of my journey so far from a doctor and now as a patient standpoint as well.
So thyroid cancer sometimes can present with no symptoms at all. Can you share with us how you were diagnosed?
Some people can feel a lump, either some discomfort in the neck, or if it's small, a lot of patients may not actually feel any symptoms. I kind of had not really felt a lump or anything. I had an exam done maybe a year ago. Didn't really feel much at that time, at least. This time it was mid to end of February. We were just using to check it on our own necks to see how the pictures looked for this ultrasound probe, and so that's when I found kind of suspicious looking lymph nodes there. First thought that I had was, denial and this is probably not concerning, but then, very quickly realized that this, of course, is something suspicious. So that's kind of how I found this. Now, I did feel some lumps there. After finding that suspicious lymph node, then, one of my colleagues who's now she takes care of my thyroid cancer. She did a biopsy on the same day. We had a result pretty quickly after that.
Thank you for sharing that. That's an interesting story on how to get diagnosed. What did it feel like to be diagnosed with thyroid cancer, being someone who treats thyroid cancer?
I think there's positives and negatives. Positive is that, of course, we know about the disease, its presentation, and also its long-term outcome. Once I had the diagnosis of papillary or a differentiated thyroid cancer, in some ways, I was relieved that it wasn't the more aggressive kind. It had spread to the lymph nodes in the neck. Fortunately, it hadn't spread anywhere else. That was helpful because we've learned about this, and I talked to patients about good outcomes if it's treated and diagnosed well. We see advanced cases, we see rare situations happen where the 1 or 2% kind of patients are also being seen. So my mind kept gravitating towards, well, what if I'm one of those 1 or 2% that will have more spread, even though it is a well-behaving kind of cancer? I think there was both of those things were going on. I was fortunate enough to have support of my family, colleagues. I work at a center which takes care of thyroid cancer in a multidisciplinary manner. So I had all that support where I could kind of step back, maybe step a little bit out of the doctor's shoes and into the patient's shoes, let the treating team take care of things. Of course, they involved me in each part of the decision making. I'm sure it was tough for them too, having to deal with me.
I was just curious, how did you manage your work and personal life while you were going through your treatments of the surgery and the radioactive iodine treatment?
I did take some time off. I had very supportive colleagues who took care of the patients that I had scheduled. Thyroid cancer surgery, usually, I mean, if it goes well, I didn't have any major side effects. So the recovery was fairly quick in terms of, I guess, going back to more sedentary work. Um, there was one concern of this rare side effect of the shoulder weakness, which can happen with, especially with lateral neck dissection. Um, I was quite concerned about that, both because I do biopsies, so I need to use my hands. I also like to be active. Fortunately, there was no issues with that, and I had good strength. I hope all of anyone going through this has the ability to take some time off. I got started getting bored at home, and I remember I was doing some scheduled like a research meeting with our group, and they were all like, "You're insane. Why are you doing this?" And I'm like, "I don't know. I'm bored. I need to think about something else." So I think it's a balance.
I'm glad you were surrounded by very supportive colleagues. What was it like being treated by your colleagues?
It worked out really well. Um, the surgeon who did my surgery, I had shared multiple patients with him, including like complicated patients who had required their second or third surgeries. I trusted his surgical expertise. The endocrine oncologist who takes care of me now, Dr. Whitney Goldner, is our kind of director of our thyroid group. We work together, and I had trust in her. And we discussed that the relationship that we'll have as a doctor patient would be as much separate as possible from the professional relationship. I call this a confluence or coming together of my kind of clinical research and personal trajectory.
What are some of the other challenges that you have faced as being a doctor with thyroid cancer?
Managing the our clinical duties, right? Like we all have patients, and it's you always, if you have to change the schedule or take time off suddenly, that's always a issue which we face. Luckily, again, I had colleagues who take care of thyroid cancer patients, and so they were able to see my patients. The other one, of course, we feel like we want to have some objectivity in caring for patients. I think with this experience, of course, I have objectivity, but there are times where I've maybe seen a patient with slightly more aggressive or advanced thyroid cancer, and but then back of my mind, I'm like, well, this could happen to me down the line, which I guess technically there is a small chance for that. It's maybe decreased my objectivity in certain ways, but on the other hand, I use it in a again, trying to use it in a positive manner, in that it's increased the empathy that I can have for the patients. One of the other challenges, sometimes patients, either they've seen the kind of story or they see my scar, especially early on, it was a little bit more visible. Um, and they would ask this, right? So um, sometimes the conversation goes on a tangent because they want to know my story. But I think most of the times it may help the patient knowing that this can happen to anyone. Those are some of the challenges, and which I've used as opportunities in my work.
You mentioned that sometimes you share with your patients your diagnosis. Do you routinely share their diagnosis or you wait for them to initiate? How do you handle those conversations?
What would you do was, like, we try to put ourselves in the patient's shoes, right? And we try to think of all the scenarios and where they are in their life and age and family and all those things. It's very tough to do that, but we try to do our best. And again, everybody is different. Someone else's perception may be different than mine. I usually don't actively share it unless someone asks this question. If they do, then I tell them, well, I kind of have or am going through this. Especially if asked the question of what would you do, I do tell them about my journey.
You talked a little bit about how your knowledge of thyroid cancer helped you cope. Do you think that, sharing your journey helped you in some way as well as been helpful for the community?
From a patient standpoint, I took some time. I think I took about a 9, 10 months really, and had waited for my follow up to make sure I had a good response from the treatments. My tumor markers were not detectable, and the ultrasound didn't show any residual cancer. So I waited for that in ways that you don't want to jinx things, right? Then kind of was approached by people at university if you would that if I want to share this, and I thought it would be useful for patients or just community members who maybe have a family member with thyroid cancer or thyroid issues or are themselves concerned or maybe have some risk factors, that it may be helpful for them to know this. That was the kind of main reason behind sharing the story. If I'm able to help or decrease the anxiety for like one patient knowing the story, I think that that would be a win for me.
Is it really as bad as everybody makes it sound out to be?
If you like eating seafood and dairy and you like salt and you like all the savory stuff, it's tough. But again, it's not, luckily, Indian food. Basmati rice and lentils and all, if you make it home, actually have almost no iodine. So I hit a decent amount of Indian food during this time, fruits, vegetables, less dairy and all. I think it's tough, especially if people don't cook a lot or they don't have support. The ATA, I used the resources from ATA as well. Especially for the post-op care, the pre-op and all, I do use it for my patients quite a bit. But especially for the post-op care, incision care, which sometimes it's fine, but other times people have a lot of scarring and muscle just kind of spasm and things like that. Because of my lateral neck incision, I did have some muscle spasms.
I'm glad you had a relatively non-bumpy experience in your post-op care and your surgery and your follow-up with the radioactive iodine. Did you learn anything new about thyroid cancer that you didn't know before?
One thing I would say, it's very important to have neck exams. I was kind of a young, healthy person. I didn't really go to the primary care that much. I did have hypothyroidism from before, from Hashimoto's, since like high school. If someone asks me, I say, please make sure you've had a good neck exam. Usually, if it's concerning, you'll feel it, and that should then trigger ultrasound evaluation. My thyroid cancer actually skipped the central neck lymph nodes and actually was a very, very tiny focus in the thyroid itself of a couple millimeter, and went to a lateral left neck lymph node, which was more than a couple centimeters. We call these skip lymph node metastases, which are not very common. My research looks at immune markers in thyroid cancer, and it's led to a little bit of a question which we're trying to explore now, especially in those with these lymph node spreads that kind of skip the central part and just go to the side or lateral. What are the reasons there? Is there association with autoimmunity? Is it protective or not? I did learn that this skip lymph node metastases is not very common, but can happen when you're getting evaluated for even a thyroid mass, lump, or concern. They should have a comprehensive neck ultrasound, which includes scanning of lymph nodes. Make sure you had the gel goop all the way to your ear or your upper neck, that they went and looked there. And the third thing would be mild side effects. After the radioiodine, I do have more mouth dryness, and it's not the worst thing. I can taste fine. I have normal saliva. For the most part, I got dental exam, everything's fine, but I do need to like drink more fluids and carry a water bottle with me. um, some people have taste alteration. I had that for about 6 months and then it got better. People can have the salivary gland swelling. These are considered minor side effects. The benefit would still be more than the risk, right? So if you have a high risk disease or disease that's spread to the lymph nodes, it would still be beneficial to treat that with radioiodine. These things happen to patients. Sometimes they just try to deal with it. I do now ask specifically and give them some ideas of ways to decrease the severity of it or maybe prevent some of this, making sure they have good dental follow up. I've been paying a little bit more attention to what we consider mild, minor, because again, we took care of the patient's cancer, we've destroyed whatever little cancer is there with radioiodine, and that's all great. But the quality of life may not be the same after even a good treatment. And that's why there's been studies that loss of thyroid cancer patients or survivors have poor, actually pretty bad quality of life in some cases, even though the cancer is pretty much gone.
Is there any particular advice that you have for patients being diagnosed with thyroid cancer?
I think connect if people want to connect with other survivors or others who are going through the same process, the Taika is a good place to start. Ask questions, to decrease the worry. Looking at the society resources for patients, ATA has a lot of good resources there as well. It actually provides input on specialized centers and things like that that may be helpful for patients. Trust the process, but verify where you're going or who's kind of taking care of you, because it takes a little bit of time from diagnosis to surgery. And after that, we make a decision. It's not kind of just immediate. And as you know, afterwards too, it's surveillance. I have patients when they ask me, can you say that I'm completely free of cancer? We can say with a very high probability, like 95%, 98%. It can take a few years to say that. I think for patients, you get worried. Anytime my follow up visit is coming up, I try to keep the anxiety till a couple days before the visit, but it is a question. And so, from the patient standpoint, my advice would be know that this is a process. The main treatment in most cases initially is surgery. So, make sure, ask questions, make sure you're going to a surgeon who has expertise in it. Especially if the cancer is maybe spread out of the thyroid gland and the lymph nodes and all, because that's slightly more extensive surgery. Everyone with this surgery will become hypothyroid. I've noticed it too. I previously required like a small dose, and now I'm on a full replacement dose, and you do it. So understand that it's not kind of like one and done. Most patients will need at least some years of follow up at a minimum, and some may need it even longer, especially if they had high risk cancer. Those are suggestions that I have for patients while they're going through any part of the thyroid cancer journey.
It is a journey. What are your hopes of new things on the horizon for the treatment of thyroid cancer, especially of things hopefully to improve quality of life, or maybe some treatments for the more advanced thyroid cancers?
Most, as we kind of know, as we discussed, surgery and or in addition, radioiodine would be the treatment needed for most patients. But proportion 10-20% will can progress, and some may not respond to the radioiodine and progress despite it, and that's when we use the targeted therapies. And I think there's a lot of research going on in that area, especially to improve the time for the response to these therapies. There is, of course, combinations coming out of treatments in that setting to kind of improve the response. We're looking at some immune infiltrate. There's people who are looking at, markers, molecular markers, and of course genetic targets there. I think there's a lot of exciting things happening in the field of thyroid cancer, both when it gets advanced, and then on the other side, I think on both sides of the spectrum, more advanced as well as localized, there's advances happening. um, there's newer surgical techniques for tiny thyroid cancers on the horizon as well. I at least am very excited about all the kind of research advances that are coming up, and there is a big impetus on quality of life, right? How can we best address this? um, which kind of hypothyroidism treatment just is the best, and what are the targets we should keep? So separate from the cancer treatment.
A big thank you to Dr. Kotwal for sharing your courageous story and providing a fascinating glimpse into when thyroid physicians themselves need complex medical thyroid care. Your personal journey exemplifies the resilience and determination required to overcome this disease. It offers hope and inspiration to others in similar situations, and it serves as a powerful reminder of the importance of thyroid cancer survivorship.
You're most welcome. It was my pleasure.
Thank you again for our listeners for joining us today on our second episode of the Thyroid Stimulating Podcast, and stay tuned for further episodes.